Hey guys, I am going to show you a little sped up lower face rejuvenation. Right now I'm starting with her lip filler. She's very comfortable. She's been numbing for about 20 minutes and I'm doing what's called fencing technique, and essentially that's where I go down into the lip tissue and am creating very thin vertical struts, and I'm just trying to lift up that lip tissue. If you do notice, you can kind of see a little bit of the outline of the needle. Typically, you're going to want to be a little bit deeper than that, but because she was really wanting a natural result, I'm using a very thin product that will integrate seamlessly within her lip tissue. That's why I'm a little bit more superficial. You really want to be careful here because you have to think about the arteries that run within the lip. You've got your superior labial artery, your inferior labial artery, and then usually there's an artery about 1 finger breadth away from the corner of the mouth. So these are all things that we're thinking about while we're injecting your lips. We're not just injecting them. We definitely have to know our anatomy, what type of product we're wanting to use, and how to also create a beautiful result. Okay guys, so here I've moved on to the lower lip and I'm doing sort of the same thing. I'm trying to kind of evert her lower lip and bring out that lip tissue. We're also hydrating those fine lines and wrinkles. Again, because this is such a thin product, any little lumpy bumpies I can just smooth out with a little bit of a massage and it will look very nice. I'm actually using Restylane Refine, which is one of my favorite products, just for lip lines and more superficial injection technique. Also notice I am constantly kind of wiping away that blood and cleaning her lip. I'm using something called Puricin, which is the gold standard to kind of prevent infections, really keep the lips nice and clean. I do this anytime I'm injecting the face. I'm going to clean it very well because we're always going to be thinking about ways to prevent any type of complication. Okay guys, so I'm continuing to do that technique, and then now I'm about to switch my technique and do what's called a linear thread, and that's where I'm injecting kind of more horizontal, and I'm going into those lip lines and into those lip tubercles. Again, I'm constantly thinking about anatomy, constantly thinking about safety, cleaning her lips, and just making sure we have a great result. Okay guys, now we're moving on to the lower face. You can kind of see I'm doing my assessment here. I am squeezing that tissue to kind of see where it collapses, and that is her pre-jowl sulcus. We start to lose volume there as we age. Next, I'm going to use my cannula and place a little bit of filler. A cannula is essentially like a delivery device. You have to make a pilot hole with some lidocaine, and then you're able to basically use your delivery device to lay the product. There are some studies that suggest that a cannula is safer than a needle because essentially you are able to push aside any blood vessels. You still have to be very careful. You have to think about the arteries of the lower face. You've got, your facial artery that's kind of coming up there. You've got your mental arteries, your inferior labial arteries. There's so many arteries on the face, and so you really have to be careful and know that anatomy, and then constantly assess your patient, make sure that they are comfortable, make sure you don't see any color changes of the skin in the lower face, and really just take your time. I've kind of sped this up, but this is essentially what this process looks like. And then here are my results. Absolutely beautiful lower face and lips. Hope you guys have a great day. Thanks for watching.